Hello, friends out there. Welcome again. We want to talk about what is sexual health. What is sexual health? Come with me. Let us go. Sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. You understand? That is the definition. And when we're talking about sexual health, it requires a positive and respect approach to sexuality and, of course, sexual relationship, as well as having the possibility of having pleasurable and safe sexual experiences. When we're talking about that, it should be free of coercion, free of discrimination, and, of course, violence. It should be free of those three: coercion, discrimination, and, of course, violence. Then when we're not talking about definition of sexual health, another one, the definition of sexual health we continue to develop further as the cultural conversation continues to evolve. It is important to remember that any attempt to establish norms and, of course, an objective definition of sexual health is dangerous in that they could be used to exclude or label people as unhealthy or abnormal. You understand? So when we're now talking about sexuality, sexual and reproductive health is more than simply what individual people experience. It is more than that, far, far more than that. And sexual and reproductive health is shaped by some factors at different levels of society. Laws that affect what we do, social factors such as poverty, community norms, and what services are available to us. So in order to improve sexual and reproductive health, we need to consider and act on drivers of sexual and reproductive health on multiple levels. So the different levels can be summarized in this way. We're going to be summarizing it this way: individuals, peers, relationships, and household, community norms, social attitude, values, beliefs, services, policies, and structures. So, based on learning from behavior, change, and health promotion theory, you understand? And, of course, and practice, it is able to think about what needs to change at different levels in order to improve our sexual health and, of course, our reproductive health. And what with this one though, it helps us to organize our ideas and plans and, of course, to increase the effectiveness of our effort. So, but at times, most of us think about sexual and reproductive health lives in holistic way with HIV or STI as only one aspect. But I want you to know that health awareness is very, very important. Acceptance of and comfort with our own body, psychological and physiological enjoyment of one's own body and the bodies of others. So the ability and need to experience emotional closeness to another human being, and having return a sense of gender identity or expression that is anywhere from male to female or somewhere in between. Then, of course, we want to talk about attitude and behavior related to producing children, care and maintenance of sex and reproductive organs, and health outcome of sexual behavior. So why then does our sexuality matter? Why does it matter? Our sexuality matters because our sexuality encompasses more than sex, the physical sex. It is an important piece of who we are as humans. And we should know that it influences and is being influenced by other aspects of our lives. Our sexuality is very, very important. And I want you to know that our sexuality does not exist in a vacuum. It does not exist in isolation. So you should be able to know what sexual health entails. It does not entail, it does not consist of only the physical aspect of sex. See you